idea of what our risk program might cover. But you know, the University of Colorado is huge. People don't realize maybe how vast we are, but you know, we have 4 campuses with over 60,000 students. We're the 3rd largest employer in the state with 30,000 plus employees at any given time. And then we also have this medical campus and hospital that has priceless research and animals and human clinical trials and so forth. And we also have the Boulder campus with a top aerospace program. We have more NASA contracts than any university in the country. And people don't know that 20 of our alumni are astronauts. And we also have global operations, meaning people everywhere on the planet. We have a campus in Beijing, China. We have thousands of people usually traveling at any given time all over the globe, doing crazy things like drilling holes in ice caps and so forth. Our annual budget is about $5 billion. Then you add, you know, things like a Division I Pac-12 athletics, crazy students in dorms in Boulder. And then we're a state entity, so we have the politics of the legislature. And then by state statute, we also are governed by an elected board of regents. So that gives you an idea of what risk management deals with on a day-to-day basis. And I've worked here about 20 years, and it's always something different every day. So that was busy enough. And then this thing came along. And so it's been rather chaotic. I can honestly say, sort of at the very beginning of March, for probably 5 weeks through March into April, I worked 7 days a week from 7 a.m. till calls from regents and VPs and so forth, the president, till 11 o'clock at night, including on the weekends. It was just sort of, you know, you try to start working through 4 campuses, there's a lot to do and a lot of chaos and a lot of unknowns. So, but it was a good thing that risk management was able to participate and be that close to leadership, chancellors and the president. So that's kind of how it was, but now it's kind of calmed down that we're in a different phase. And I'd say it's still kind of a 7-day-a-week kind of a thing, but it's not as many hours, but I'm loving every minute of it.
Well, thank you so much for all that you're doing. For anyone joining a little bit late, I'm going to kind of repeat the question after we have a couple panelists answer it. So currently we're talking about a day in the life before and during COVID-19. Lissa, why don't you share with us the RTD perspective?
From RTD, I have to basically ditto what Emily and Terry had to say before COVID hit. I mean, in risk management, you're attending a lot of meetings, you're solving questions, people popping in your office, asking questions. Every day you learn something new. You know, I've learned a long time ago never to say that I've heard it all, because that just kind of jinxes me. So, fortunately, it's a 9-to-5 job for me as well. Before COVID, there's obviously when stuff happens, your week gets longer. Since COVID, though, and working remotely, my entire staff works remotely because we not only are self-insured, but we're self-administered. So I have a staff of 6 that are handling claims. Fortunately, at RTD, we have a complete separate safety department that does all the loss control and the safety related issues that are governed by anyone from the Colorado PUC to the FRA, the Federal Railroad Administration. So they deal with all the safety requirements and all of that. So my world is more in after things happen when it comes to claims. And of course, I procure insurance and answer questions, review contracts. So a lot of my duties have not changed, but I really miss the social interaction. And I think my team does as well. Unfortunately, not every member of my team has video chat capabilities with their home computers because we did not provide our staff with laptops, only 2 of them, I think, and the rest of them just had home computers that they could make work. So we're not even getting the video chat going on, and I think that's kind of wearing on us all. One thing that I think has been really beneficial to RTD is RTD historically has, kind of said no thank you to allowing people to work from home. And as a result, where we're now have to work at home, I think upper level management, senior leadership is realizing maybe they need to rethink their policies, and it's really okay for employees to work at home because we're still getting the job done. We're still doing what needs to get done. So that's been nice. Also, that I have to admit, not having a commute, or I should say a 30-second commute from my bedroom to my office, I gotta love that. But I'll be looking forward to getting back into the office and getting back to the way things were.
Definitely. What about you, Randal?
Yeah, thanks, Sarah. I can say that it's been a pretty easy transition for me as far as a day in the life, because I've been working from home here in Southern California for the last year and a few months now. But we're still working through our insurance renewals, claims processing, contract reviews, driving risk management initiatives, even though we've had to change our focus on a lot of those. And just speaking to my team and people back in the office and our employees in the manufacturing plants, their day in the life has changed quite a bit. They're now required to wear masks in the common areas, social distancing wherever possible, performing employee screenings and temperature checks before coming into the office. We have paper towels and cleaning supplies by all the high-touch surfaces like doors, and staying home if they feel any sort of sickness, of course. So the day in their life has changed quite a bit, but for myself, it's been pretty business as usual.
Absolutely. Thank you. Alrighty, for our next question, what responsibility or risk does an employer experience in bringing employees back into the office? So a little bit about what you were just touching upon, Randal, but let's go ahead and have Terry start us off with that.
Well, I'm going to answer mostly in regard to our traditional campuses. We've got, again, 4 campuses, and one of them is a medical campus, and that is an entirely different animal on its own. And so I'm going to answer more about administrative personnel. Again, we've got faculty, researchers, doctors, and that's a whole different kind of an animal also. So again, traditional campuses and administrative folks, but I'm assuming, our responsibility is going to be the same as everyone's, which is the number one thing is the health and safety of all of our employees and the well-being of their families and our customers, our students and visitors and so forth, and making sure that we do everything by all of the health guidances. And again, we're fortunate we've got this Anschutz Medical Campus of experts, so we can also lean on them for guidance, and CU tends to kind of go above and beyond. So we really do look for guidance, and we go a step beyond that. So, and that's going to include all the safety protocols that I imagine everyone's talked about, the cleaning, the distancing. And again, our responsibility is to make sure that everyone's safe and healthy and that we don't cause a spread or a spike and with their families and so forth. We want to make sure that we that we have things in place because we want our employees to be ready and comfortable to come back. So we work very hard to try to avoid confusion, make sure things are clear, our communications. We want there to be positive morale when they come back, because again, I think this is stressful in many different ways. We feel we're responsible for when they do come back, of bringing them back, that they're productive. And we want to make sure that we can keep and maintain jobs and salaries and all that kind of stuff. So we put a lot of effort into that, bringing people back. And our biggest risk, I think, is everyone's is, we need to make sure that we're doing everything in compliance with all of the different guidances. So whether that's a federal, state, county, and again, we use our own Anschutz Medical Campus. We don't want to do anything that's going to be out of that kind of guidance and not compliance with that. And we also think we're responsible for making sure that we plan accordingly. So it's very smooth rollout again. So there's no confusion, there's no chaos, it lessens anxiety. And then we also plan for other scenarios, like if there is a spike or an outbreak again, then what kind of communications and protocols do we have to have in place? So we're planning for that in advance, just in case. And then, like I said, I will mention, all the campuses have research, but the Anschutz campus is a whole different animal with doctors and priceless research and you name it, we got it on that campus, and that requires a whole different planning effort and protocols. So that's, I think, kind of in a gist of what we're doing.
Thank you. What about you, Lissa?
Sarah, I told you it was going to be tough to follow Terry because he's going to take everything I said I was going to say and he's going to say it. So I'm just going to sit here and go, ditto, Terry. Or obviously, we have a huge responsibilities to our staff to provide a safe workplace when they come back. We're providing the masks, and the disinfectant wipes at the, at gathering places, just to make sure, even around a copier, so people can wipe down the copier every time they use it. And one thing that we really are going to be focusing on is getting our employees to trust transit again, because our employees, I'd probably say 99% of them take our own transit, whether it be bus, light rail, or commuter rail to work. And our ridership is down so much. And so I know that's another question down the road about the efforts that we've taken to make our transit safe to ride again. And that has to start with our employees. Our employees have to feel safe before we can encourage additional ridership. So that's one thing, that a responsibility that we have, obviously to the public, but to our employees as well. And along with Terry, a risk of bringing them back is, it could be an uptick in the virus. It's a little scary that people can be carriers without having symptoms, and I have no idea how to address that. At this point in time, I'm not anticipating we're going to require everybody to be tested before they come back to work, but we do have a questionnaire we can have them fill out before they return to their offices. And inability to maintain social distancing just because of the way some of our offices are set up. We may have to rearrange where people sit, which will obviously impact their ability to do their job. But I don't have much more than Terry provided.
No, that's great. Thank you.
Mm-hmm.
I'll go ahead and repeat the question. We're talking about right now, what responsibility or risk does an employer experience in bringing their workforce back into the workplace? What about you, Randal?
CoorsTek manufactures parts for a lot of different industries, including medical, communications, energy, and we have been deemed an essential business during this time. So our manufacturing operations have been going on at full force, and the number one responsibility for us throughout this time is also piggybacking off of Lissa and Terry. It's keeping our employees safe, complying with local legislation, educating our employees, making sure we have enough personal protection equipment for them, providing guidance now as we're entering the lifting shelter in place orders. But along with that, the largest risk for us is employees getting lax about the best practices, and it becomes a bit more challenging if we're ignoring social distancing and being able to contact trace who those employees have interacted with. So it's very important for us in front of mind to continue to educate and be aware and perform those best practices to keep our employees safe.
Definitely, thank you. And Emily?
I don't have much to add to what everyone else said, but just thinking about this question, my mind races, specifically with all the risks that there are with bringing your employees back and how you do that. We have a task force right now set up that are working on policies and procedures. I think every employer is going to have new standards for operations going forward. You have to have a policy in place and apply it consistently to all your employees. One of the things that I think is a really big risk is the mental health of your employees. A lot of people have a lot of anxiety due to the COVID-19, and they're scared. They don't want to get it. They don't want to be a carrier. They don't want to see their family members get it. So managing that mental health risk, I think, is one of the biggest things that an employer can do for their employees, and that would be through some type of employee benefits program. We have a program at Pepsi Center that is offered to all employees, and they can go and have a few sessions with the mental health counselor and sit down and talk through those worries and anxieties. And I think that is a really helpful tool to give to your employees. And also being very clear and communicating to your employees, these are the steps we're taking as a company. These are our goals that we want to accomplish during this transitional period, and being open to receiving feedback from your employees as well.
Absolutely. Thank you for bringing up the mental health aspect of it too. Similarly, what risk measures will each of you take, not on the internal side, but on the external side with your respective organization to protect your customers or your business partners that you're working with? And we'll go ahead and have Lissa start with that.
Yay! I get to go first. I'm just kidding, Terry. Anyway, actually, RTD has done wonderful things to protect our passengers. For example, they are limiting the capacity based on the size of the vehicle. For example, some of our buses are limited to 15 passengers. Our bigger buses are limiting passengers to 20. So the operator, actually back more towards an employee safety, we put plastic chains up, blocking off the front couple of rows of seats, and gone to rear boarding to protect our operators from exposure, which has helped, and we've waived fares. So with the passengers, the operator can count them, and if there's more than 15 or 20 passengers, they can bypass a bus stop and call dispatch, and dispatch will send another bus to come and pick up those passengers. So we've got a lot more on-call buses waiting just for those scenarios, and we've added buses to our more popular routes. That's been very difficult because of the decrease in ridership. We've also done some pretty drastic reductions in our service. So while we reduce service in some areas, we're using some of those staff to cover other areas. For example, on the rail cars, we're limiting passengers to about 30 on those. We did our Access-to-Ride program is offering food delivery to our passengers, so that's another benefit we've provided to our passengers. When it comes to both employees and visitors to our facilities, our safety department has actually put together a matrix that's based on decision criteria. For example, if there's been a steady decrease, for over a 14-day period, a decrease in new COVID reported cases, then employees will be allowed to return to work, and managers are encouraged to stagger that to do a gradual return to work. We're requiring and supplying the face masks for all of our staff to do so. In that same matrix, it also says, okay, this is what we're going to do with our passengers now. Instead of maybe 15 per bus, maybe we increase that to 20. those kind of things. And so we can get back to a point where we can do front door boarding and start our fair program again. And it also discussed visitors. Right now, we're not allowing any visitors at any of our facilities right now. So again, as the number of new cases goes down, we start talking about when can we allow visitors in the building. The biggest thing is social distancing. We may go back to the office, but we're still required to do the social distancing of the 6-foot rule, still do these online meetings, that sort of thing. So as the pandemic lessens in severity, then we can, we've got a matrix to lessen the restrictions both for our employees and our business partners and the passengers that we serve.
Absolutely. As someone who takes light rail to work when things are normal, it's great having these insights. Thank you.
Right.
Randal, I know that looks a lot different for CoorsTek as a manufacturer. What does that look like for your company?
Yes, it certainly does look a lot different since CoorsTek's manufacturing plants are largely closed to the public. So we have restricted access even further to those regarding customers and business partners to really only those mission critical people, and trying to utilize mediums like Zoom or Microsoft Teams whenever possible. And then if a visitor or business partner does have to visit a facility, they have to go through the same temperature screenings and questionnaires that our normal employees would. Also, our travel has been limited entirely to only mission critical travel as well.
Thank you. And what does that look like for you, Emily?
Sorry. We're still trying to figure that out on our end. We are not considered a essential business. So even though the lockdown in Denver is ending Friday, we are still mandated to stay closed. We want to, when we do open, we want to open safely. We want to do it right. We want to be in compliance with all city, state, and federal mandates. We also have the leagues that we have to look to and follow certain rules and regulations that they're going to put into place as well. So for us, we're still kind of formulating those procedures and what it's going to look like when we can actually have guests back into our building.
Absolutely. And Terry, what does that look like at CU?
Well, Sarah, I was going to say, I was going to try to maybe include that answer in the next question for me, just because they kind of tie together a little bit because of the students in our community. Is that okay?
Yeah, absolutely. And kind of just to clue in the audience, Terry was going to answer next about the safety measures that CU will be taking in the dormitories and classrooms moving forward.
Yeah, and again, I'm going to focus on our traditional campuses, meaning Denver, Springs, and Boulder, and not really talk about our medical campus because they have a whole, again, different protocol with researchers and the hospital and the whole thing. It's very different and very challenging for them, and that's a very different protocol that they're working hard on. So, for us, each campus has leadership, and the chancellor runs each campus. And like I said, they have a leadership team, and they've been working round the clock on a million things. Because when you close and open a campus, it's like a small city. And so they're working on it. And so a lot of the discussions that are taking place we don't know for sure, but include potential things like maybe, returning in the fall or the semester in phases. Maybe classes would have start times be staggered, different times of the day or days of the week. They're discussing a possible, combination of some face-to-face classes and some remote learning classes like we're doing now. And then of course, all the safety protocols, I don't know if people realize, but when you go to any of our campus, so Denver, Boulder, doesn't matter, but we have buildings everywhere. We've got a ton of buildings. And so, we have to revisit building access and policies about that, and how we're going to check people in, and entrances and exits, that whole thing for visitors, students, faculty, it doesn't matter. And we're looking at, again, because of distancing, that maybe we have to use some of the larger classrooms, but only have half or less people in there. So this way, we can maintain that distancing. For dorms, possibly a single occupancy instead of double in a dorm room. We have a lot of large events. We've got concerts, we've got, presenters, presidents come speak, so forth. So we're trying to work through those. And of course, we've got sports, Folsom Field. There's been discussion about maybe streamlining, streaming those kind of games. And so there'd be no one in attendance, or maybe very few attendance. Just don't know what that would look like yet. We'd be, having to figure out, we're going to require what kind of personal protection equipment. Are we going to require it for students, faculty? What about students or faculty or visitors that are high-risk individuals? Once a vaccine's available, are we going to require it? Things like that. We're looking at the layout of classrooms, the cafeterias. We got all these different dining halls and food courts, common areas, how to lay those out for social distancing. And like I said, the food courts, we might have to not only limit occupancy, but change how, instead of a buffet style, it'd be served or something. We're not sure yet. And our shuttles, we might have to have fewer people allowed on our shuttles that run between campuses. The biggest issue we have is, regardless of what we end up doing, is a big issue is how we're going to enforce it. If people aren't social distancing, how do we enforce that? How do we discipline that? Do we make people sign some kind of enrollment contract that says they're going to abide by it? Imagine, you just can't. Picture the Boulder campus right now with a bunch of students. Well, not right now, but before the pandemic, that place is packed. And so even if they had a reduced enrollment, kids are kids, and they're going to be in groups. They're not going to be social distancing. So how are we going to enforce that? Those are tough questions when you open up a city. And what if students become ill? Then how do we isolate them? Where do we quarantine them? All those kinds of issues. So there's a lot of things that the campus chancellors and their leadership teams are working, like I said, round the clock on trying to figure this stuff out. And it's very stressful, but they're doing a great job. And I'm confident that we're going to have a plan, but we're just going to have to work through a lot of issues.
Absolutely. Thank you for those insights. And for those of you joining us or who didn't know, all of these questions today are actually your questions. When you registered, we had you submit those. So I went through and curated your questions. These are all questions submitted by you. So thank you so much for submitting those. And I want to give a chance to each of our panelists have a specific question that was directed for them. We've just listened to Terry's. I'll go ahead and call on Lissa for a question that came in about what riding public transportation will look like moving forward. I know that we kind of touched upon that a little bit earlier, but anything further that you'd like to add, Lissa?
I was just going to say that, unfortunately, I basically already answered that in a prior question. One thing that Terry made me think of is enforcement. Unfortunately, for example, the city of Denver municipal code was just recently modified that said everybody shall wear a face mask when out in the public. And it could be subject up to fines of up to $999 per violation. I just read that yesterday, and I think it goes into effect today. That's nice, but our operators are not police officers. So if somebody boards our train or our buses and are not wearing a face mask, what do we do about that? I know that we increased the signage on our inside of our vehicles, basically saying, with the pictures of the little guy wearing a face mask and asking people to please be mindful of others and that sort of thing. We do have transit security officers, both in our employ and contracted out. But when you're a public agency and it's our job to transport people safely, it gets, that's a fine line between what we can enforce and our obligation to our public to do the transportation. So with that being said, I think over time, as the COVID cases decrease and people are going back to work, they should feel safe riding our transportation. I know our cleaning department is doing, nightly sanitations and hopefully in the end, it won't look any different than it did be pre-pandemic. But I really don't have anything more to add that I haven't already said. So
that's great insights. Thank you. With that brings us to our next poll real quick. We talked about your affiliation with CU Denver. Now we're going to see how many people took public transportation prior to COVID-19. And I'll give everyone about 30 seconds or so. And also, I didn't say this earlier, but I promise all of these are anonymous as well for anyone who's concerned about anonymity. All right, it looks like we have most of the votes in, so I'll give you a few more seconds. All righty, it looks like the majority of us took the light rail. I'm definitely in that boat. Took it into work every day. We had some folks take the bus. And then we had some people sometimes take public transportation. So thank you so much for sharing that, everyone. Alrighty, and our next question is actually going to be for Emily. And Emily, do you have any idea, I know it's a little early on, do you have any idea at this point when the Pepsi Center will reopen? And I know we kind of touched upon it earlier, but anything you'd like to add about measures that you're kind of planning to take when it does come to reopening?
We do not have an opening date yet. I know we're all, really excited to get our teams back and to have concerts back in the Pepsi Center and just, get that community going again. We're all anxiously waiting for the green light, but at this point, it really it's following those city, state, federal mandates that they've put into place, and we're just all kind of guessing at this point.
That totally makes sense. I know we're all anxious. I know I'm a Nuggets and Avs fan personally, so
yeah.
Thank you.
Yeah.
And Randal, with CoorsTek, I know, as you had mentioned, that part of your manufacturing is of medical devices. Has CoorsTek changed the output for any of those components that you work with? And how has manufacturing changed at your community or at your facility? Is anything additional you want to add?
Yeah, our manufacturing output has changed quite a bit in the last couple of months. Since things like elective surgeries have been put on pause, we've really slowed down on manufacturing. We make a ceramic hip implant, but also there's been opportunities where we're now focusing on manufacturing substrates and sensors where the end use goes into equipment like thermometers and ventilators. So we've been making these parts for companies like Ford, who have pivoted their operations to address this critical need now. And then in the overall manufacturing operations, it has changed slightly. It's mainly just around how we do things that I've already mentioned, like social distancing, preventative cleaning, those employee screenings. For areas that we can, we've adjusted workstations as well to try and meet that 6-foot social distancing, and then providing flexible work schedules for our employees who have families, kids at home, and also being able to provide a week of additional pay related to COVID. So just having to be flexible where we can.
Absolutely. It's all about flexibility right now. Thank you. And we've talked a lot today about masks and personal protective equipment, or PPE. So we're actually going to do one more poll. It's our last poll of the day. Lissa had mentioned that as of today, if you had not heard, there is a mandate in effect in the area of Denver and some other areas of Colorado that will require masks to be worn inside or in line for essential businesses, healthcare facilities, and public transportation. So again, this is an anonymous poll. I'm just curious, who all wore masks before the mandate went into place today? And I'll give everyone about a minute here. All right, it looks like it's mostly in. A couple more coming in. Alrighty, I'll go ahead and share the results. The majority of everyone said yes, you did wear a mask or some sort of face covering. That's wonderful. As Lisa mentioned, there is going to be some sort of fine. So if you live in the Denver area and you don't have a mask, make sure to get one. Thank you. Alrighty. For our next question, we're going to go switch back to a question for all of our panelists to answer. And we had a great question that was submitted by a student today before our panel. And one of our RMI students would like to know from all of you, what would you suggest to anyone who's getting ready to graduate as far as preparing themselves for marketing themselves in the present and in the future? And I'll go ahead and have Lissa start with that.
Thanks, Sarah. I think my advice would to graduate, well, to anyone in the RMI program, would to understand that risk management is a business based on relationships, and your word and your reputation is very, very important. A handshake still means something in the risk management world. I mean, obviously everything's converted to writing, but relationships are just so key. And also, you have to admit to yourself that you're not always going to have all the answers, but you do need to be able to say, I don't know, but I'll find out for you. You have to be open to change and be able to adapt to a constantly changing environment. And my last piece of advice is learn as many different ways as you can how to say no. So that's my advice.
I love that. Absolutely. And Terry, what would you recommend for our soon-to-be graduates?
See, Lisa, now I follow you and I have to say ditto, see? So I agree with Lisa wholeheartedly. I'm just giving her a hard time. Relationships are everything. You know, in my case, I would suggest I'm a little bit old school. And so you know, the only thing you have to kind of see how this person's going to perform is obviously their resume. So you know, they have to have a strong history of how hard they worked. And I don't mean like I mean, it could be at jobs, but at everything they've done. I mean, at least, again, I'm kind of old school and I believe in hard work and long hours and that kind of stuff. So I look for that. And then the other thing I'll throw in is, you know, it's amazing the number of people that will apply for a job. They'll send in a resume and a cover letter, maybe. and a couple of things. One is they won't even follow the directions. I mean, the application directions, it'll say, send a cover letter in. They won't do it. Do this, they won't do it. And I'll be honest, I kind of think, if they can't do that, then I don't know, and then they'll, if they do get an interview, and usually it starts with some kind of an initial interview, whether it's a phone interview or something, I am shocked at the number of applicants that had done almost zero research on the company that they're applying for. They didn't go to their website. They don't, they know almost nothing. And again, we'll ask those kind of questions, and I think, well, I guess if they're just going to dedicate 2 minutes into their research, they must not be that serious. So those are big things for me, but I'm kind of old school. These millennials, they're a little bit, I got 3 of them in school. So maybe it's just me, but that's my advice.
I love it. Thank you. And Emily, what would you recommend for graduates?
I have to echo Lissa in get to know people, because who you know will get you a long way. Your reputation will get you a long way. This is a very close-knit community, the risk management community, and everybody knows somebody who knows somebody else. So it's develop those relationships, constantly work on them, because that's going to get your foot in the door to get the job that you want. Also, I always like to tell students this is, and it's kind of what Lissa had mentioned earlier, is always think outside the box, because you're never going to run into the same situation twice. There's always going to be something that surprises you. There's always going to be something that you're like, well, I didn't expect that. So just be willing to think outside the box, come up with creative solutions, especially in the world that we live in now. The insurance industry, the insurance world is changing so much that, these trading dollars for insurance dollars, it's going in a different direction. So just be willing to come up with creative solutions and really think outside that box of let's get an insurance policy.
Great, thank you. And Randal, especially as an alum of the program, a lot of you are, what would you recommend to our soon-to-be graduates?
I'd recommend 2 things. The first one being networking within your local risk communities, whether that's joining your local RIMS chapter, or there's other groups as well. And I know that right now it's tricky since there aren't in-person events, but here at LA RIMS, we've transitioned and we've been doing virtual events, and it presents invaluable opportunities to associate with risk professionals who you normally probably wouldn't get the chance to interact with. And then the second thing is studying. I know studying is probably the last thing you want to continue doing right now, but working on your insurance designations, or whichever career path that you take on. I'm currently studying for my CPCU, have my textbook right by the desk here, and continuing to develop those skills and getting those credentials that will make you all the more marketable. So that's all for me. Thanks.
Nice. What
Sarah,
test are you studying for?
Sarah, I was going to add one thing.
Oh, yeah.
And I agree with what Randal, what everyone has said, but this ongoing education, I try to tell I have 15 people in risk management for all the campuses, and a lot of them are younger people, and I tell them all the time that they have to constantly continue to be educated. So just like this program here, but like Randal said, whether it's a CPCU or an ARM or a CR, it doesn't matter. The insurance industry invented designations, I think. So they should always be doing that. But I noticed a lot of young people, they kind of don't want to do that, or they wait. And you can't hurry up and try to do that when the opportunity comes. You have to already be doing that and have it ready, so when the opportunity comes, you're the best candidate, or you're among the best candidates anyway. So I would echo what everyone has said and what Randal said about continuing your education throughout your entire career.
I ditto that as well. Thank you. Great. Well, I want to make some time for a few closing remarks. I'm pulling up something on my screen to share real quick. Thanks for bearing with me. Alrighty. So I wanted to take a moment, of course, to thank everyone for joining us today. It's been great having everyone. Thank you again for submitting your questions in advance. Panelists, you did an amazing job. I can't thank y'all enough for taking time out of your busy, crazy schedules right now to participate in the panel. You've been a pleasure to work with, and it's great meeting you and working with you. I wanted to thank everyone who helped make the panel possible this morning. Huge shout out to our RMI Program Director, J.O. Banerjee, and our Assistant Director, Lori Janucki. Also our Assistant Director of Events, Michaela Erickson. And you don't know that they're on the call, but also our Business School Help Desk and IT team, especially Olga and Will, for joining us today and making sure all of our tech issues were worked out. I also wanted to take a moment and congratulate all of our graduating seniors. We were just talking about them, both at CU Denver and our RMI graduates. I know that some of our seniors are on the call today. Huge shout out to them. Thank you for joining. Good luck in your finals. For those of you not part of the school, their finals are right around the corner. Some are this week, some are next week, and they'll be officially done next Friday. You're almost there. Congratulations. Also, for anyone who is on the call, a student and looking for summer or fall classes who's not graduating, definitely be sure to send me an email, sarah.kelsey@ucdenver.edu, and I can get you more information on our fall and summer classes coming up. We were just talking about professional development, staying current with the industry. We also offer a undergraduate and graduate certificate program in risk management and insurance. That's a great thing to add to your resume as an industry professional. And I just wanted to thank everyone again. Before I let everyone go, do any of our panelists have a few last words that they would like to share?
I would say good luck to all the graduates. And, I read something recently that risk management is now a really hot career area because of this pandemic, and I believe it. So it's good timing and good luck.
Hey, Sarah, I noticed on the chat a couple of questions were asked. Did you want to look at those real quick, or?
Do any of our panelists feel comfortable with those? We can go over that really quick. Absolutely. I believe it was about, my button went away. There we go. About PPE, personal protective equipment.
I can say that as an essential business, our operators, all of our employees are wearing masks, and we, like everyone else, could not get them in. But we have an upholstery shop that started making masks for us, and we've had quite a few donations from our business partners, even our member of our board of directors is supplying the homemade cloth ones that are reusable. So fortunately, we do have enough to give to our employee population just through donations. So we've been very fortunate in that respect. And so that's in response to Rob Foster's question about tips or tricks in finding PPE. Cleaners, I don't know how public this is, but I guess if you're a public institution, it's public. Our city apparently, through our procurement, found a hemp company in Colorado Springs that is manufacturing sanitizers, a sanitizer, I should say. And apparently we're ordering like gallons of this stuff, and it's very reasonably priced. So that's my only input in regard to Rob's question.
Awesome. Thank you for catching that. Would anyone else like to add or have any closing remarks for everyone?
Yeah, I'll jump in just regarding the PPE. Something that's been very important for us is in case we do use, let's say, homemade PPE, just making sure that it's gonna still be safe for whatever operations that our manufacturing employees are doing. Making sure it won't get caught in the machinery, or that it's the quality that is acceptable with our EH&S folks. And then I just want to thank you again, Sarah, and thank you to the CU Denver Business School for having me on the panel today.
Thank you so much for joining us. Really appreciate it.
And I was going to
To
answer,
Randall.
Tanner had a question about the full body suits.
Mhm.
And I can just say that, you know, the university is exploring those kinds because of various areas of research and patient care and so forth. So it's just different areas of the university. It wouldn't be typical, but we are looking at those.
Good to know. Thank you for jumping in and answering that. Great. Well, I know we have about a minute left. Again, feel free to contact me, reach out to me. You should have gotten an email from me this morning. Feel free to give me a call or email if you need anything at all. Really appreciate everyone joining us today. Great job to our panelists. We are recording this, so if there are some parts that you missed, we will be putting that up later on for public viewing as well. Thank you.
Thank you.
Thank you. Take care.